know. Makes it itch a little, doesn't it?
This is actually doing a tremendous job of healing. All these bones and tendons were exposed.
Wow, that is.
So this is just really, really nice. Very positive. And it went all the way over to the sides here. You can see how we're granulating across. This is very nice.
That does look a lot better.
Is Lucky medicated, like on painkillers and stuff?
Oh yes, we're on something called tramadol, which is really good, and some other painkillers as well, and antibiotics.
Oh, he's standing on
But
wonderful.
yeah, we're getting there. He's not putting as much weight on this, but he's walking on both of them. Same thing on this paw, except it wasn't as widespread on the right. So we're going to soak this.
Shh, 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 shh,
Just
stop.
checking the toenails now.
Stop. Good dog. Good dog. You're such a good dog. Yes, you are.
Yeah, this paw was even a little bit bluish when we first started, so I didn't think we were going to be able to save the leg, but I think that we're moving definitely in the right direction.
Okay, come on, stand. Come on, there we go. There we go. Good dog.
Things down there.
Good dog.
Try not to pop off. Let the camera kind of
Oh,
be like that.
okay. There we go. No. Put your leg down in there. Come on. There you go. Yes. Good dog.
He looks young.
Yeah, he's not old at all. Not even a year.
Oh, wow.
His hair's all growing back. This was all bald and raw. It's all starting to grow back. This was all flaky, but it's coming back now. Come a long way in a few days.
Oh, yeah.
And you can see his disposition is really wonderful.
It is.
That way it just kind of bathes the paws, gives them a chance to circulate, and then what we do is we alternate wet and dry bandages.
Mhm.
And today's bandage will be like a damp, kind of an Epsom salt type bandage. I think he knows that this is where he gets attention to.
Yeah.
A lot of personal petting and that kind of thing. You're such a good boy. He's gained about 2 pounds since he came in, so that's also good.
Mhm.
Really another positive for us. He's a little on the small side.
Okay.
Yeah, who knows what he got to eat or didn't get to eat when he was in his formative stages, and I think he'll do a little more growing, but he's kind of undersized to some extent. And he was so thin too before.
Right.
And all of that challenge to his hair, whether he probably had a flea infestation. We're not finding anything else other than the staph infection that he had. Dealing with that and the skin being so irritable to him, it probably drew a lot of his weight down as well. His legs have to itch and hurt a little bit, even though he's on the painkillers, but he's just very easy to work with. Those first few days were challenging though. I mean, he hurt a lot.
Yeah.
Before the pain meds started to kick in. It was bath again, and we're just gonna try to let the camera get most of the view of those front legs, and just kind of lift the bucket out from under him.
Okay.
There we go, right down on the table. Okay.
Come on. Good. And you're very sweet.
And the paw still, it's really swollen, but it looks viable. It had a real bad bluish color when we first started, so I think we're gonna be able to, still looks positive. I just lift this one a little bit. Got some injury over here to the side of the toe, but it still looks
I know.
viable. Okay, all right.
It's okay.
Lay back up.
Okay.
Toward me. The wet pad that I'm going to use. I love this bandage. We've saved a lot of legs with this stuff. It's like an Epsom salt bandage. It seems rather simple, but works really well for our patients. And with this, we just pad the toes just a little bit.
No, 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 no. Come on, no licking.
Just a little bit.
There we go. Yes.
And the pad between the toes just protects those sensitive digits. And leave the toes open for comfort.
Okay, reset.
Nose forward,
Okay.
all
There we
forward.
go.
There you go. Trying to pose into it.
There we are. How's
So the
that?
folks can see
Yes.
what we're trying to.
Say hi to everybody.
This one, see as we walk. I think another 2 or 3 days he'll be moving better. He's just a little reluctant to put his paws down.
Yeah.
Squeeze.